debate on lymphadenectomy's value in endometrial cancer is still not over. Now, in the era of precision medicine, we would like to have molecular markers, but until we have those, one could ask if sentinel node would not be an elegant way to obtain the same information on prognosis and adjuvant treatment as a complete lymphadenectomy while decreasing the extent of surgery and the potential morbidity. The findings of our study were inspired by the pioneering work of the team of Abu Rustam at Sloan Kettering and the elegant work done by many research groups around the world on sentinel nodes. What we found is the injection of dye in the cervix yields about 80 to 90% detection of sentinel nodes. Interestingly enough, 60% of those sentinel nodes were the only node involved, meaning that if you miss it, you can take out many nodes. If you miss that one sentinel node, you will not get the information you're seeking. Our data showed a trend in regression-free survival favoring sentinel nodes over complete lymphadenectomy. This was together with a decrease in 20% of external beam radiation compared to patients who would not have had lymphadenectomies. 8% of the lymph nodes that we detected as sentinel nodes were in basins that are usually not harvested during complete lymphadenectomy. That means that, again, if you do a full lymphadenectomy, you would still miss 8% of those most crucial lymph nodes. Half of the lymph nodes, in addition, that were positive came in patients who had a pre-op diagnosis of grade 1 endometrial cancer, meaning that grade 1 endometrial cancer might be also important to perform sentinel node dissection. Most of the patients that recurred in the pelvic basins after a negative sentinel lymph node, actually, when we went back and ultrastaged them, we found that invariably almost all of them had micrometastases or isolated tumor cells, suggesting that those ultrastaging found cells are also important in prognosis. So overall, sentinel lymph node seems to be a better value for the patient because we provide the pathologist with the most important node, the sentinel node, while decreasing the extent of the surgery, avoiding potential morbidity in those patients who have complete lymphadenectomies.